Welcome to Glass Half Full with Leslie Krongold. She shares her stories, experiences, and knowledge of living and coping with a chronic health condition. Learn about tools and resources and hear inspirational interviews that help you to live a life filled with quality and dignity. With 2 decades of support group leadership, Leslie's ready to help you make lemonade out of life's lemons. Are you ready?
Hello. Today's episode is all about hearing. I've wanted to address hearing loss for a while and hope to interview a woman I know in the local disability community. She has a condition which has caused her progressive hearing loss. I can't remember the name of the condition, but she reads lips, and she also has this device that can be worn around the neck of someone she's speaking with, which enables her to hear better. In fact, I have worn it when I've talked to her a couple of times. Anyhow, we've been in conversation for over 3 years about doing an episode on hearing loss together. But she's been hesitant and non-committal, so I finally discovered someone to address these issues, an audiologist who is even a fellow podcaster. The other hearing-related issue I'm thrilled to finally address is that beginning with this episode, I will have a captioned version on YouTube. People with hearing issues don't listen to podcasts. I've had a few requests for episode transcripts, and I've been investigating free automated services because, transcribing an audio interview is time-consuming and onerous. Anyhow, there is something called an audiogram, which is the easiest way to go using an online application that transcribes the audio track. The main drawback for me is that it allows only one visual. It seems like a video with a transcription of the dialogue running along the bottom of the screen, but there's no change in visuals. And I would have all the Glass Half Full episodes captioned. So I'll now commit to this, yet the majority of them will be audiograms. I'd love to have visuals for all of them. After all, I did go to film school, but it's so time-consuming. So I'll do a selection of them, in a real video style when I, have some extra time, but most of them will be audiograms. Back to my guest, the audiologist, Dr. Lilach Saperstein. We met in a Facebook group for podcasters, or rather, I saw her post about her podcast, and I realized she'd be the perfect guest. And she is. You're going to learn a lot now about the ear, which I suspect you have 2 of. I knew. Anyhow, she covers everything from good ear health hygiene to some of the more common hearing loss conditions. Dr. Saperstein is originally from New York, but now lives in Haifa, Israel. She is currently working at the Rambam Medical Center on the cochlear implant team, and she is very passionate about all things related to the ear. By the way, one acronym mentioned frequently in this conversation is ENT. That's an ear, nose, and throat doctor. They're specialists, and I actually saw one this last year.
Audiology is an incredible field, a field of healthcare, of medicine, that deals with any disorders of the ear, including hearing and balance. So what a lot of people don't know about audiologists is that audiologists do lots of different things, not just hearing tests and maybe giving out hearing aids, which is something that many audiologists do, but audiologists work with children and adults, so people throughout the lifespan, from babies all the way through geriatrics. And they can work in hospitals and ENT practices and private practices, in schools, and also part of industry with some of the companies that make the devices that people are using. So lots of different things that audiologists can do. You have audiologists in private practice, and you have plenty of audiologists employed by hospitals. And I think the different route, how you would get to one or the other, would be based on what are the symptoms, what are the presenting issues. So if someone is having kind of a typical issue with their hearing as they age, then they'll probably find themselves at a private practice looking to get solutions for that, maybe a hearing aid or some other communication device, or they just want to get their hearing tested, so they'll find someone in the community. Whereas if someone else is experiencing a more medical issue, they're having otosclerosis or any kind of middle ear disorder, or they have balance issues, so those things that are more heavily medical, then they'll probably go through the ENT, which may or may not be affiliated with a hospital, and then they'll see audiologists there.
I asked Dr. Saperstein, how common are hearing problems?
When we talk about babies, it's about 2 to 3 out of 1,000 babies will be born with some level of hearing loss. About one in 1,000 will be deaf. So that's when we're talking about newborn babies. But when you talk about the population overall, 1/3 of people over age 65 will have hearing loss. And when you get to age 75, you're up to half. So it's really one of the most common conditions across the lifespan. And there are so many different causes. So, someone who is born with hearing loss has something very different and a very different experience than someone who develops it later in life. And this is something I talk a lot about on my podcast, that you need to be able to know what kind of hearing loss you have and what was the source of the hearing loss, what age did the hearing loss begin, to really know how to deal with it. And so, like, sometimes you hear people say, hearing aids don't work because I know, I'm a man who's 85 and he doesn't hear anything even with his hearing aids. So children shouldn't use hearing aids. It's like two totally different cases, different kinds of hearing loss, different devices, when people try to extrapolate from one anecdotal issue to everybody. That drives me crazy. But to answer your question, there are a lot of things that can lead to hearing loss. And one of the easy ways to understand this is about how ENTs, our ear, nose, and throat doctors, and our ear, nose, and throat are all connected. They're all like one big system with our sinuses and with our throat. So sometimes when there's a general sinus issue, that can lead to backup in the ears and cause like middle ear issues where there's a lot of fluid or ear infections or things like that. And if that goes untreated, or if that becomes a chronic issue, then that can cause permanent hearing loss in the middle ear. And then there's just other issues that happen to the permanent hearing loss in the cochlea in the inner ear, and that can be from head trauma, like a car accident or any kind of thing like that. It can also be from acoustic trauma, which is like really loud noises, gunshots, blasts. We see that a lot with veterans or people who work in the music industry and or in factories. So there's that cause of hearing loss. And there's also medications. Unfortunately, a lot of medications, especially medications given for cancer and things that are life-threatening, they have a side effect of causing hearing loss. So you have that in the population of people who survive a major health situation, and then they survive that, which is wonderful and amazing, but then many times they have this side effect of the medication.
And that's fascinating. I have never heard that before.
Those drugs that are for cancer are really destructive in many ways to the body. Mm-hmm. So one of the things they are is ototoxic, toxic to the ear, or they can also be vestibulotoxic, meaning they're toxic to the vestibular system, our sense of balance. Yeah, and you want to, of course, you want to save the person's life. You want to help them, get over this life-threatening illness, and so hearing is not on the priorities. But there is a lot of monitoring that goes on with people who are going through those kind of treatments, where you can try and get the dose where it's effective but not harmful,
So there were a few terms that I probably gleaned from listening to a couple of your podcast episodes and looking at your website. Can you describe conductive hearing loss, sensory neural hearing loss, and mixed hearing loss?
So to understand these terms, just a tiny brief overview of how the ear works, which is my favorite thing to talk about. So we have three parts of our ear: the outer ear, the middle ear, and the inner ear. The outer ear is the part you can see. It's the part we call our ear, where you might have earrings, where you could put your finger in your ear canal, and that's funneling the sounds in. It's bringing sounds in from your environment and sending them in to the eardrum. And then the eardrum is where the middle ear starts. The eardrum vibrates to the sounds that are coming in, and behind the eardrum there's three little bones, the smallest bones in the body, the ossicles, and this chain of bones vibrates and then moves the sound, moves it forward into the cochlea. And then the cochlea is where inside of there's fluid that's supposed to be there, fluid that's kind of going through this snail. And all along that spiral, there are these hair cells. Those hair cells are nerve endings that are then sending those signals up to the brain. So when you have the outer ear, the middle ear, and the inner ear all working and all functioning properly and everything's in place, then you have good hearing. And also the nerve needs to be working as well to send the messages from the ear up to the brain, and then the brain needs to process it. So really, the process is bigger than just the ear. It includes the ear and then all the different parts of the brain that are processing the sounds. So if there's a problem with the outer ear or the middle ear, that would lead to a conductive hearing loss, because sounds are not being conducted properly. They're getting stuck. So there could be a hole in the eardrum. There could be tons and tons of wax, so sounds can't get in past the wax. There could be ear infections or fluid in the middle ear space where those little bones are. Because if you have those little bones, they need to move, and they're supposed to have air around them. They need to be in a cavity, a space. But if that space fills up with gunk, like fluid, that's a technical term, right? Like
it's a Latin, I think. Yeah.
Yeah. Like back up from the nose, or ear infections, or any of this like glue ear, very, very, very common in childhood. That's like 75% of children will have an ear infection before age 2. Mm-hmm. So that's one of those things that like is very, very common in early childhood, but adults get it too, and it's very painful and uncomfortable. So anything that's obstructing sound from getting into the middle ear or the outer ear would be considered a conductive hearing loss. There could also actually be problems with the little bones themselves. They can break, or they can become stiffened and hard, so they're not moving correctly, all different things like that. Whereas the other kind of hearing loss, which is sensory neural hearing loss, is where there's a problem with the cochlea, with those sensory cells that are inside, and they float in the fluid, so they need to be able to be mobile. If they become immobile or if they die off, then that will lead to a sensory neural hearing loss. Or if there's an issue with the nerve, so it's like a delineation between which part of the ear has the problem. Mm-hmm. Is it the conductive part or the sensory neural part? And if somebody has elements of both of those issues, then they would have a mixed hearing loss.
Mm. So is that part of your role, is to sort of tease out what's going on, where, the origin of the loss is?
Precisely. That's a major part of the diagnostic process. When you do the hearing test in the booth, in this little tiny room, you're raising your hand every time you hear the beep, but actually more things are going on there than just getting how loud you can hear the sounds, because we can test just the cochlea by itself and then test everything from the whole pathway from outside the ear. And then if those things are different, then we can know that where the problem is. Is the problem in the cochlea, or is the problem on the way to the cochlea, or in both?
So these diagnostic tests, do you need to do them in person, or is it like telemedicine? Does that has that impacted the field of audiology?
That's definitely on the horizon, and it's coming.
Uh-huh.
Some of it has started, But really, to get a full diagnostic picture, you need the equipment, you need the sound-treated room, but most importantly, you need the expertise of the person who's doing the testing. Because even if you had all the equipment and didn't, know what you were looking for, like we just mentioned, there's some apps that you can kind of do a hearing test with, and they can be pretty accurate, but they're not going to give you all that information and also know what to do with the information, who to refer you to, or what the treatment options are. And there's a reason that, audiology is a doctorate degree. It's a 4-year degree, not a medical degree, but it is, a clinical doctorate that requires all this background history. You have to know how to ask the questions so you get the information you need, and how it fits in with all other diagnoses and things like that.
What could you recommend as preventative behaviors for ear health or auditory health?
Yes. Okay, so one of the major things that we can do is to protect our hearing from very loud noises and very loud environments that will go on for a long time. So what that means is if someone goes to concerts or very loud events, and that's one time that they're doing that, once a year, okay, so they should go enjoy the concert. But if they're the kind of person who's going, every weekend, or, the whole summer, every weekend in the summer, they have something going on, or that they themselves are in an industry where they're exposed to this. We see a lot of music engineers and DJs and people who work in catering or things like that, where they're at events, at weddings all the time or things like that. And that's one of the preventable kind of hearing loss, is a noise-induced hearing loss, because someone was exposed to loud levels of noise for a long amount of time. We can definitely use ear protection, earplugs, and ear muffs. People who are using really extensive machinery, even for a hobby, like jet skiing or mowing the lawn, and, gardeners and things like that. So people should be using those earmuffs and earplugs, because they really do bring the noise down.
Mm-hmm. Yeah, especially those leaf blowers. Oh my gosh,
yeah.
They're horrible.
Yeah, they're annoying you when you're in your house and they're doing the neighbor's yard.
Right.
So can you imagine if you're the one holding that leaf blower, how loud it is to how proximity?
Yeah. Mm-hmm. I'm sure it's quite damaging.
Yeah. I always pass by the gardeners and make sure they're wearing their earmuffs. I keep an eye on them in my neighborhood. That was the first thing, of protecting the hearing. But the second thing is that getting a hearing test, I would say pretty much when you turn around 50, is a good time to go and get a hearing test, just to have one on file. Even if you don't think that you're having any problems with your hearing, it's a good idea, because if there's a little bit, and if you could monitor it, and then you go 5 years later and you see, was there a change? So if you have the data and you just have a hearing test on file for you, that's very good preventative kind of medicine. Just like you go to the dentist every year, I'd say around middle age is a good time to start getting annuals. And for sure, if you're having any issues with your hearing, or you feel like you're saying what all the time, you're having trouble on the phone, it's a great idea to do the hearing test as soon as you feel like there's anything going on, especially if someone else tells you that you're having the problem, because that's usually what happens, right? The spouse or children or coworkers will say, why are you not hearing me? And you don't know what you're missing if you're missing it.
So if someone notices some hearing loss, whether it's someone, telling you, or you just are able to be aware and mindful that, yes, you do have some hearing loss, what should they do? Should they just talk to their doctor at first?
You can talk to your doctor, but you can also make a appointment with an audiologist right away and just go in for the hearing test, because sometimes doctors actually are not as proactive as we would like them to be. Physicians sometimes look at things like quality of life kind of things. If you're not suffering, you're communicating fine with me, everything's fine, right? So I think this comes into also personality, what kind of person you are in general with your health. But if you're noticing a change and you're asking the question, that's enough. That's enough to get a hearing test, because our testing doesn't just look at how the hearing is. It's also looking at the health of the ear. If there's a difference between ears, that's a red flag. Why are your ears different? They're the same age and you eat the same thing with, your whole system. There's no reason why your ears should be different. Or if someone has a chronic issue with fluid and they don't get that looked at, it can turn into something permanent. Whereas if they would have gotten help and treated it, then it would have resolved with medication. Or there's just so many things that it's not like, well, this is what it is and nothing can be done. Sometimes things can be done. So go and find out what it is. And something that's incredibly dramatic that many people don't know about is that there are some viruses that people can just have a cold, upper respiratory infection, and that can have an effect on someone's hearing. It's pretty rare. It's called sudden sensory neural hearing loss, and it's exactly that. It's just sudden, usually after a viral infection. And if it's caught within the first 48 hours and someone is getting steroid treatment to counteract what the virus is doing, then it can save some of the hearing. But if they miss that window, then that's pretty much the end of that ear.
Mm-hmm.
It's very, very unfortunate. We see that a lot, that people come in with that issue and then they went to the doctor. Maybe they did, maybe they didn't, and no major drama was made about it. It was like, oh, your hearing went down dramatically over one day. Let's just wait till tomorrow and see how it goes. Instead of going to an ENT, instead of going immediately to get your hearing tested, like that's an emergency. Mm-hmm. There's not a lot of emergencies in hearing in audiology, but that's one of them. So I will put that out there just in case anyone needs to know that. And tinnitus is extremely common, especially with people who have hearing loss. Sometimes it's one of the common reasons that people come in is because they have tinnitus and then they discover that they have hearing loss. And when people have ringing in the ears, it could be their brain producing the sounds that are not coming in. Like, how come I'm not getting these sounds? I'm going to produce them myself. Then they drive people crazy. They can be very, very difficult, hard to sleep, hard to focus. Those are the, extreme cases. Everyone gets a little tinnitus once in a while if you haven't slept well, if you're very tired, or if you were in a loud environment and then you came out of that environment. You sometimes have all sorts of thoughts like, am I hearing things? Did I hear this? Did I hear that? But if someone has a chronic, loud, obnoxious tinnitus, it could really interfere with their life. Mm-hmm. So then again, we have different things to do, different maskers where you can put in a sound into, the easy version is having a fan on or something like that in the background. But we can have these little devices that kind of look like hearing aids that aren't hearing aids, but are just producing a constant stream of white noise or sounds of a river or something like that to help cover up the tinnitus sound. And there's also a lot of CBT, cognitive behavioral therapy, that goes into that. That's outside my scope, but a lot of referrals with that.
So that's cognitive based. See, what did you CBT?
Yeah, cognitive behavioral therapy.
Okay, right. I wanted to make the distinction that you didn't say CBD.
Oh, no, I don't know anything about that.
Okay.
Yeah. I worked for a few months in the Veteran Administration Hospital in Brooklyn, the VA. Mm-hmm. And we had a support group for veterans with tinnitus. That was a weekly support group. It's a very common issue, especially if people had acoustic trauma, mm-hmm. those IED blasts and all those things. It was a group run by the audiologist and a psychologist. There's a whole curriculum of making peace with your tinnitus, because part of the problem is that if you're hearing the sounds all the time, then you get angry and upset and anxious that you're hearing them, and that's then the problematic cycle. But maybe making peace with your tinnitus, and then it's the new background. You have your own music.
Your own white noise, yeah.
Yeah, which is kind of a hard pill to swallow for some people. But there are lots of different approaches and techniques for dealing with tinnitus.
So what led you to launch a podcast?
I launched my podcast, the All About Audiology podcast, because I think I was getting that itch where I just always wanted to be talking about audiology and having this great interest and enthusiasm and passion for what I do. And I needed to do that without driving my husband crazy. and I felt like there were some things that I wanted to say that were a little bit, maybe not controversial, maybe not harsh, but taking a stance on certain issues that I felt were important to be broadcast. And I said, no one is going to give me a platform if I don't take it for myself. So I had the motivation to get some of my message out there. A lot of the things that I do are with children and with the education of children who are deaf and hard of hearing, and how the conversation around cochlear implants and sign language and language deprivation was happening. I felt like there's a bit of not misinformation, but maybe incomplete information. So that's kind of my soapbox. But I really do love talking about how the ears work and how our brains process sound, because it fits in with our emotional experience of the world, and it fits in with how we create relationships. So it's like a much bigger topic that I have an interesting, sneaky way to get into,
Do you have anything to say about those candles that people use for,
God. I'm rolling my eyes is my answer.
Yeah. It always seemed kind of weird.
No. Okay, so there's actually an amazing YouTube video from an audiologist, Dr. Cliff. He did a test side by side where he burnt one down just in a cup and burnt one down in someone's ear, and the result was identical. So basically, if they show you what comes out of your ear, quote unquote, it's actually just the candle itself burning into a nasty gook that you can think looks like earwax, but is just the candle itself. Not to mention how dangerous it is to have a fire right next to your hair. Not a good idea. So no, this is not a real thing in my professional opinion. And if you have earwax, then you should see a professional ENT or audiologist that does cerumen management, which is fancy words for they take the earwax out in a safe way.
Is it common to develop more earwax as you age?
It's a lot of factors. It has to do with your sebaceous glands, which are the parts of your skin that make oil.
Mm-hmm.
So the oily glands, and then it mixes in with dead skin cells. So the skin cells of your ear canal with the oily substances, with hair, with dust, and that all mixes up into making earwax. And our ears actually flush that out in their own natural system, which is amazing. The way the skin grows, it grows in this rotating outward way. And you really should never, ever, ever use Q-tips, because they will just push it in deeper and cause more harm than good. Plus, they can cause scratches. Oh my gosh, the people who use pins, don't get me started. Do not use anything sharp in your ears whatsoever.
So how should we, okay, so no Q-tips. So tell me,
It's so dangerous, no.
What's a healthy way?
You should, after you take a shower, you should just use a little washcloth or a towel or a napkin and wipe the outside of your ear, and that's it. Now, if you're someone who's using Q-tips all this time, then it's going to take like a week or so to recalibrate, because the ear is going to make as much wax as it needs, and if you keep flushing it out, it's going to keep making it. So someone who's always using Q-tips might have a couple days where it's uncomfortable, let's say, but it will all even out. And if some people who do get a great accumulation of wax should have that removed by an ENT who has all this special equipment. The ENT has all this tiny equipment and lights and cameras to get it all out, and irrigation, like a water sprinkler and drainage system. It's complicated. You don't just want to go in there with a pen or a bobby pin.
Ooh, no.
It's based on like your hormones and your skin level and that. But I don't think it's more common as you age necessarily. I think it's just an individual thing.
Okay, that was my personal question.
Yeah. What's interesting is people who use hearing aids, they do develop more wax, because the hearing aids are blocking that natural mechanism of clearing out the wax. So people who have hearing aids do need to have their wax cleared out more often.
Good to know.
That's common. I would like to talk a little bit about communication strategies, which I think are the overlooked and amazing thing that audiologists teach their patients and really can teach everyone communication strategies that help you communicate better when there's misunderstandings from the level of mishearing. Like, I didn't hear you well, or I thought you said this, but you really said something else. And that happens to everybody, even people with normal hearing in a quiet environment. It happens. We all experience that. But people with hearing loss experience that much more often, and it really can begin to interfere with your relationships, with your productivity at work, with all the things that matter, talking on the phone. And the more hearing loss there is, the more isolated someone can become, and avoidant of those situations, which are just more and more frustrating. So one of the things that we teach is using communication strategies like asking someone to rephrase what they said if they didn't hear properly, because if they just repeat it, it might be difficult to hear those same sounds again. So instead of saying what, or say that again, asking someone to say, I heard this part of your sentence, but what was the second part? Or can you say that in a different way? Right? So learning how to ask the question that's helping you to hear better in a conversation, and advocating for yourself, for what your needs are, like where you're going to sit in a restaurant, like not near the kitchen, like get a quiet spot, or even what time you go to a restaurant. If you're having trouble in that environment and you want to have a conversation with your people that you're going out to eat with, then maybe recommend a quieter place or a different time of day, things like that. Learning to work around the things, I think that applies to any kind of limitation, you might say, instead of having it as a limitation, working with it, and knowing what are the things that you can change that will make it easier to communicate and overcome those barriers.
I did two things soon after interviewing Dr. Saperstein. I made an appointment with my HMO for a baseline hearing test because I don't think I've had my hearing tested since I left seeing a pediatrician. And the second thing, I stopped using Q-tips. I hope these podcast episodes reach a larger audience now that they'll be available on our YouTube channel with captions. I will no longer say thanks for listening, but my announcer may continue saying it. I'll speak with him about it. Thanks for continuing to tune in to Glass Half Full podcasts, whether it be online, on your phone, on YouTube, or any other place you follow us. Thank you.
Thank you for listening to Glass Half Full. Leslie invites you to leave a rating and review on iTunes. This helps spread the word to others dealing with chronic health issues. For show notes, updates, and more, visit the website glasshalffull.online. glasshalffull.online.